So I'm delighted to be here to speak about the amazing things that Oak Street Health is doing in our community. Specifically, when we're talking about mental health and physical health, this is a one-stop shop at Oak Street Health. Oak Street Health has developed so many new programs in medicine to help our community. In addition to that, the mental health services that we provide in center are also becoming a major component in our neighborhood. The reason why is most people who come for medical services, they also have additional underlying issues. And if you have a one-stop shop to bring all your medical needs, your psychological needs, even social service needs, right? Most of the times you have to go to different centers for these types of activities. At Oak Street Health, we serve as a resource hub for seniors or adults on Medicare, right? So say you are on Medicare, you do qualify for Medicare, and you're looking for a primary care physician. The reason why Oak Street Health will be beneficial to you is because Oak Street Health services individuals in the community within 3 miles of the facility. What does that do? That reduces the amount of patients that you have in the clinic to see the doctor. A lot of the times the patients come to me as an outreach exec and they are so delighted that they don't have to have such a long wait time to see their doctor, right? Oak Street Health did a survey. They identified the cries in our community from our grandparents, from our old adults in our communities, our senior leaders. They identified those cries that they hear in the medical system and made those changes. We handed out some of these pamphlets earlier, but I just want to touch base on a few of these bullets, right? Choice of in-person, phone, or video visits, right? Oak Street Health has a state-of-the-art medical system called Rubicon. Rubicon allows us to interact with our specialists while you're at your primary care physician appointment, right? What does that do? That limits the amount of times our seniors have to go from doctor to doctor, navigating through New York City to get health services. Oak Street Health has identified those things and made those changes. In addition to that, 24/7 support helpline, around the clock care, right? Let's say you are a patient with Oak Street Health and God forbid you do go to the emergency room. Oak Street Health assumes that medical bill, right? You go into the emergency room. Oak Street Health doesn't get paid by Medicare unless we're able to prove that our patients are going to live a healthier lifestyle. You get a complete care plan, right? What does this do? You don't get that urgent care feeling, right? Um, Another thing I wanted to touch base on was connections to trusted insurance agents. Trusted insurance agents. There was a time in New York City when you could walk into an insurance agent in front of any corner and they would be trying to promote you a type of insurance to get you to switch. Some of us are familiar with that in this room, right? We have trusted insurance agents at Oak Street Health who we work with around the clock to ensure that you get the best Medicare supplement for your plan. What does that look like? We have a public relation manager, a patient relation manager who interacts with each and every patient that comes into Oak Street Health to make sure that you have a custom care plan designed especially for your medical needs. In addition to the medical services, it's the events that Oak Street Health does. Every day we're doing events in our community. So it kind of poses as a senior daycare center in a primary care with social services, with mental health services. What does that look like? A resource hub for our community. So I'm delighted to be a part of Oak Street Health. I've been an outreach exec I'm hitting about 7 months at Oak Street as an outreach exec. I go into our communities. I meet with our seniors. I meet with our older adults on Medicare. And when I inform them about Oak Street, they end up telling me about Oak Street, the difference that they seen when they came in the door. So that's why I'm excited to be here today. I thank the panel for inviting me because this is what we need in our community, right? We need to, as young folks, and even as older people, to promote a healthy lifestyle, feeling good, waking up having a book schedule, doing events, that's our livelihood, right? So that's a part of what we do at Oak Street Health. And that's why I'm excited to be here today to explain it to you. Thank you.
Thank you. Josh, I would like to say something, and I'd like to say to the audience, I am a patient at your facility, and I switched about 6 months ago from New York Presbyterian Hospital to you all, and I'm very satisfied with the services. I like the special care that you give and the fact that you don't rush. When I talk to a doctor, the doctor takes its time and explains everything about Oak Street,
Absolutely.
about what's wrong with me, everything. And that's a wonderful feeling when you feel comfortable talking to your doctor and that you're not being rushed, you're not on a clock. So I take my hat off to your organization for that and your different services that you provide the community.
Amazing. I really appreciate that feedback. And that's much of the feedback we get at Oak Street Health. And that's my reward. I'm in the community, I'm meeting people who've never heard of Oak Street Health. And when I see them walk in the front door for a welcome visit for the first time, it's almost like a chilling experience because I know what Oak Street Health is about to do for them, right? Today, I have a sign up sheet. If you have any friends or family on Medicare, we have a sign up sheet. We're going to invite you for a welcome visit. You come into Oak Street, you make the decision. You'll see the difference in the medical care. So you'll be able to make that decision when you walk into Oak Street. You may know any senior in your neighborhood or any someone with disability who may have Medicare. Everyone on Medicare is not age 65 or older. You have some individuals on Medicare who have disabilities or whatever circumstance. And you really care. Oak Street Health is probably the best place to refer them at this time. It's a one-stop shop for all their needs.
Joshua, you alluded to it earlier, but would you let people know the value-based medical care that is the future of medicine? So because I don't know that people understand, are used to going to the doctor per visit, but the value-based medicine is a bigger conversation. So would you share with the folks a little bit more about that, please?
Absolutely. When you're talking about value-based and you're talking about medical care, right? You want to ensure that you're getting a complete plan that's going to ensure that your medical needs are being met. Most of the times, doctors are so stressed out with the amount of patients that they have to see. Oak Street Health identified that and made that change. So now, your doctor time, your time to come to Oak Street and meet the doctor is your special time. There will be no one else booked at that time but the individual booked for that patient. What does that look like? That looks like 51% of all Oak Street patients stay out of the emergency room. That's 51% of our patients that come into Oak Street Health for the first time and they become long-term patients, 51% stay out of the hospital. So when you look at value, when you look at quality, when you look at a one-stop shop for all your Medicare needs, that's what Oak Street Health has for your value.
Thank you for coming, Joshua.
Thank you.
I wanted to know, aside from the age category, what are some other qualifications that an adult would need to get care from Oak Street Health?
Right. In addition to the age range, like I mentioned briefly before, you must have Medicare to be able to qualify for Oak Street Health to be your primary care, right? So it looks like you have Medicare, you need a primary care physician, you come in for a welcome visit at Oak Street Health, you meet with our doctor, and that conversation with the doctor will be a significant decision for you because you'll know right then, am I going to follow through with my primary care or, am I going to continue with the previous medicine I've been receiving? So to answer your question, you just have to have Medicare and have a plan that we accept under Medicare.
Okay. And one more question. How do you service the mental health community?
Yes, we have behavior specialists and social workers in our clinic area at Oak Street Health. So, that may warrant during your welcome visit or during your doctor's visit, maybe the doctor may just make that reference like, hey, we have, social services right here on staff. A lot of people coming to Oak Street Health are seniors, and it's saddening sometimes to hear some of the issues they're going through, like with rent arrears, social service issues, community issues, community affairs. They have all these things going on, and how do you live a healthy lifestyle with all these barriers going on? Sometimes you just need someone to talk to, right? I'm also, our outreach execs are also, we're accessible 24 hours. I have some outreach execs that I just wanted to highlight who are here today. Sebastian, he's an outreach exec. Sierra Caldwell in the back, who are outreach execs. And, we get calls constantly throughout the day from seniors we interact with, just want to know, which way to go, how to navigate through things. So you get a full support team.
Joshua, one of the things also that I found very positive about your company is the fact that I was able to sit down with a social worker and talk about some of my issues that I've been having over the past few months, and took the time to really listen and assist me in different other areas that I realized that you all do is help with people with housing. If you're back with your rent, you're able to sit down with a case manager and talk with them. And so there's a lot of services that you all provide. And it's not just, your physical, but, like if you can't pay your bills and if you have no food to eat, then it's going to affect your mental life. So it all intertwines.
Absolutely.
So I'm very glad to see the agency within the community. As a matter of fact, you're just like 3 blocks away from where I live, and you actually come and pick me up and bring me back home. So I'm very, very satisfied with the services that you all render to the community.
Right. And that's one thing. I'm so glad that you brought that up about transportation. Each of your appointments at Oak Street Health, we provide transportation to and from our clinic. Right. So that's another resource that Oak Street Health identified and made the change for our community. Thank you.
Joshua, pleasure to have you today.
Yes. Thank you.
I have a question. Location. Are you only located in Queens, or are there other boroughs where they provide the same services to people who are on Medicare?
Excellent question. We are currently in 4 boroughs, with the exception of, who could take a guess what borough? right. Y'all know that, right? So we're soon we'll be in Staten Island. We're actually Oak Street Health derived in Chicago. I think the longest clinic open in New York is maybe 5 years. Don't quote me on that, but it's pretty new to New York City. But yes, we have clinics in 4 boroughs at this time. Queens, we have our newest location is Parsons Boulevard, right next door, 8914 Parsons Boulevard. That's our newest location. We have locations Cambria Heights, Suffolk Boulevard, Brooklyn, Canarsie area, Washington Heights. So we're really expanding. Also, CVS just acquired Oak Street Health. So a lot of our campaigns do on a weekly basis. Yeah, I see a lot of eyes open up when I said that. CVS recently acquired Oak Street Health. So a lot of our campaigns that I do throughout the week, I'm campaigning at CVS in our community. So I hope I answered your question.
Yes.
Thank you.
Yes, thank you.
All right. I know you have one of your partners that wanted to come up and talk a little bit. Is she here? Sylvia?
I'm sorry.
Oh.
Yeah.
Hey, Sylvia.
Yeah.
Good morning, Sylvia.
morning.
How are you?
Good. Thank you. I was just passing by my business card because I'm helping Joshua and his team right here. But
Okay.
I'm the outreach manager. I work at Canarsie location. So we have different locations for Oak Street. And if it's anything, if you guys need any help, like Joshua mentioned, we have different locations in New York. And also we have overall United States. We have over more than 25 centers. And we're expanding, more like this upcoming year. We are trying to do open up locations at the Staten Island, New Jersey, Westchester, and it's this company is in business more than 10 years.
Okay.
So we are really want to give, the best that we can, like talking about services, more to be like personalized, like so the people can be able to come to our clinic and trust us. And besides that, we are selected by AARP.
Yeah, I was just about to ask you
So,
that. How
yeah.
are you all connected with AARP?
Yeah, so we are having a good relationship with them because that's one of the companies that we are selected by AARP. So whenever, let's say, like if whoever would like to come in and become a member and patient of Oak Street, we will be able to, they're going to have a membership as an AARP. So it doesn't really need to sign in or something, or to have, sometimes they just pay like any like monthly payment. So in this case, when they become, like our patient, so automatic they will come, like they will be able to be a member of AARP because we work with them. Yeah, but thank you. I'm the outreach manager that I just say, like, if you guys need any help, you can be able to contact Joshua. That's my team member. I have Sierra back there that she's helping me out. That's in Canarsie area. And the same way with Sebastian, that he works together with Joshua. And usually, that he works with one of my coworker, outreach manager, Carlos Ramos. So he's the one who usually works right next door in this facility.
Okay.
And 8914, Parson Boulevard. If it's anything, we're here to help and support, more for benefits of our
And
seniors.
what is your hours of operation? I forgot to ask you that earlier.
We open from Mondays to Fridays. So that was, most of the time it's from 8:30 to 5 p.m. But other than that, let's say like if you guys would like to set up appointments with insurance agents, with, our social worker. So all the time we just be really like, like in advance, we are really like set it up these appointments within these business hours, of course, for Monday to Friday. But thank you, for having us
Thank
here
you for coming.
and to give us, a time to have, to speak and give this information to the community. And because usually, we really need that so people out there can be aware and have knowledge, what it's Oak Street about. Thank you so much.
Thank you all for sponsoring everything today, Joshua and Sylvia. I really
Thank you.
would appreciate. Thank you very
Thanks.
much. Yes.
Really quick, just in reference to sponsoring, that's another thing that I really want to highlight. A lot of us have church organizations, groups, luncheons that we want to sponsor. That's where you want to come into Oak Street Health. We're willing to sponsor those types of events. You might need refreshments, giveaways, things like that. Contact an outreach exec at Oak Street Health. We're willing to help you with that in your community.
Okay.
Thank you.
Thank you. Thank you.
Thank you.